Hello, this is Dr. Lewerenz at Longevity Health Institute. I hope this finds you well today. I thought I would share with you, it was super common, done this for about 15, 20 years in our practice, maybe not 20 years, about 15 years, and that is allergy, food sensitivity, and immunity testing in our office. This is super common, actually pretty common now in the functional medicine world or holistic medicine practitioners doing this, but I wanted to explain to you the importance and why we would do this and then how this test is performed and what it means. So actually, very common in our world now, we're having a lot of people come up with food sensitivities, food allergies, actually full-blown anaphylactic reactions to peanuts, to strawberries, to seafoods. Actually earlier today, I actually just had a patient to pineapple, which was unique, and this is why I'm bringing this up to you today. We got her food testing back, and it gave us a lot of insight, and a nice insight into something that will really help her. But the interesting thing is this, is most people don't understand what is happening at the level of the gut. We have two types of immunities, Th1 and Th2. And at the gut level, because there's such a protective mucinin layer and these epithelial cells, and there's a lot going on between the epithelium, the mucinin, and then literally the digestive lining where you absorb, which include then immune responses directly in your blood. So, and these are happening within millimeters, okay, of each other. So you can see by stress and eating poorly and certain medications and that over time, having an American diet, a lot of gluten, a lot of sugar, a lot of dairy, a lot of processed things, how you can develop digestive issues, how you can damage the gut lining. In fact, studies have shown that stress alone can delete or minimize the mucinin production and this snot, literally like healthy lining to the gut. So then you can start to break tissue down at the digestive level and then start creating these reactions. So when we test somebody's immunity and food sensitivities, and we usually do these and kind of parlay them together, what we're really testing is an antibody. We test IgG and IgE. Now, IgG reactions are food sensitivities. These meaning that they have some forgiveness. They fluctuate depending on what you eat, how much damage is to the gut. And an example of this is if you have a digestive barrier issue or a permeability digestive issue, or essentially, which often a lot of people are told they have IBS, or what functionally we call now leaky gut. You will have a IgG reaction typically to foods that are harder to digest, foods that are harder to break down, also foods that you eat the most of. So it might be healthy food, could be broccoli, could be berries, it could be spinach, things that are very good for you, a good fat, fish or something, salmon. The reason you would be reacting to it is what you're getting the most of. So it's what the gut is getting inappropriately broken down at that lining. So it's not always bad foods for you. That's IgG sensitivities. Now, certain foods, your nightshade vegetables, and certain foods like gluten and dairy, more commonly to peanuts, egg, these are higher probability of sensitivity. And why that is because they take a lot of energy, they take a lot of enzyme, a lot of acid, a lot of things to actually break down and assimilate these. So, again, gluten in our country is so modified and so agriculturally Frankensteined, if you will, that's not a surprise. In dairy, actually, we lose enzymes to break down lactose and the albumin, and becomes more inflammatory the older we get. So these are kind of causes, but actually very common things that can ebb and flow, these IgG reactions. Why do we want to identify them is because if we're trying to fix a gut, step one of fixing digestive health, IBS, leaky gut, inflammatory bowel issues, autoimmune bowel issues, you name it, step one, eosinophil, by the way, colitis or esophagitis, GERD, heartburn, acid reflux, these all fall into this to some degree. Step one is identifying the immune issue you're having to. because you, just like any wound, you need to take away irritation. You need to limit or de-inflame the lining. So you can't eat things that you might be reacting to. And for instance, gluten or dairy are really common, but in this lady that we identified, pineapple, she's not going to be able to have this for 3-4 months. Now down the road, we'll rotate this in. We'll start to give her it back a little bit after we've done some healing to the digestive barrier. Now the other test we do is IgE. Now IgE reactions are full allergy reactions. They're full immune reactions. Most of the time, people know this, meaning they have a rash, they have an allergy, runny nose, itchy throat, maybe they wheeze, maybe they have full anaphylaxis where they can't breathe, etc. But they can be variable. Some people vomit, some people have diarrhea, but these are more profound reactions, and usually they know them. Occasionally they don't because they might be a low-level IgE. We still want to take those away. Now, some of those can be forgiven and can improve over 3 to 6 months, meaning they'll calm down. Most of the time, they don't fully resolve. Depends on how good we are at healing the barrier and how much we've improved overall immunity, which usually we're pretty successful with, but those are kind of variable. But you first don't want to irritate the gut lining, so you have to identify what the person's eating and reacting to, okay? Put them on a modified diet for 3 to 6 months so that, again, you give this epithelium, this digestive barrier, a chance to heal. You can't heal a wound or heal anything if you're irritating it. In fact, I tell patients, and it sounds kind of goofy or backwards, but I will tell patients, I promise you, I can't help you if you eat poorly. So if we test you and show you that these antibodies are showing a reaction in your body, these are things that are causing inflammation and immune issues. If you continue to eat them or you continue to have gluten or dairy, you're actually going to just waste time, my time, your time, and actually create further and further digestive damage and big immune issues. And again, this is a big cause of tons of autoimmune reactions in the body. In fact, it's the base or foundational cause of a lot of autoimmune reactions. I personally believe it's a big cause of a lot of what we're seeing rise in any immune issue, meaning infections, allergies, and even cancer to some degree. Okay, we are what we eat. So you have to start at the digestive lining and digestive level for most health things. We are what we eat. We are what we eat eats. You've heard me say that before. Okay, and you got to do the appropriate protocols to fix the gut lining that we have here at Longevity Health Institute. But it's got to start with fixing your diet and identifying what you're reacting to. And we do that here and do that very effectively. So hopefully that gave you some insight into food sensitivity, food allergy testing. We do it here all the time. It's a pretty simple blood test, get back in about 7 to 10 days, and then we can give you the exact protocol that we use. So this is Dr. Lewerenz, Longevity Health Institute. Hope this enlightens you, educates you a bit. Share with others. You can find us on the web. You can find us in our supplements at our warehouse, carewell.com, on our website. You can find us on YouTube, on Instagram, and longevityhealthinstituteinc.com. Again, share this with others around the country, around the other states, because I love spreading the word of good health and knowledge to friends and family. And let's keep doing forward progression of health and wellness. This is Dr. Lewerenz. Be well.